Muted.
Welcome, everyone. This is Dr. Lynette Fraga. I'm the Executive Director at Child Care Aware of America, and I am pleased to have you join us this afternoon for this very important conversation. We look forward to the discussion this afternoon, and again, appreciate your patience. I look forward to hearing from our colleagues at CDC as well, who is a valued partner and leader and expert in both disease prevention and health promotion. So again, a big thank you to our two CDC presenters today, Jessica Franks and Dr. Sonia Rasmussen. We are grateful to have the involvement of the Children's Health Team and Pregnancy and Birth Defects Task Force as well with us today to discuss this important topic. We recognize that not everyone can make it at this time as some are busy caring for children. However, don't worry about that. We are recording this webinar and we'll be posting it on our website as well. So we are, again, wanting to emphasize the fact that providing a safe environment for our children is a top priority. And you've likely heard quite a bit about the Zika virus in recent months, and you know that Zika is primarily spread through the bite of an infected mosquito. Child Care Aware of America wants to make sure you know more about Zika and how to prevent mosquito bites. So we again greatly appreciate the timing of this webinar, as during the summer months, children may be with you for extended hours, and by spending more time outdoors and playing outside, children are more susceptible to bug bites and stings. Not only can they be both bothersome and annoying, but they can also make people sick. So it's important to protect those around you. Before I begin, I just wanted to share a little bit about Child Care Aware of America for those of you who may be unfamiliar with our organization, who we are, and why this is important to us. At Child Care Aware of America, our vision is that every family in the United States has access to a high-quality, affordable child care system. The child care system supports children's growth, development, and educational advancement and creates positive economic impact for families and communities. Throughout the nation, nearly 11 million children under the age of 5 receive child care. Children make up nearly 25% of the population in the United States, and most children spend an average of 36 hours each week in child care. We are trusted to care for children in times of health and in sickness, and that is why learning about Zika is so very important. We are very fortunate to be able to focus on emergency preparedness issues thanks to our new emergency preparedness team. Our emergency preparedness team at Child Care Aware of America launched and relaunched last December. So as an organization, we've been working on this issue for a number of years. In the past year, we've had the opportunity to create more focus in this arena. So it's in a very important area for us. Because children are impacted by emergencies and disasters differently than adults, work in the field of emergency preparedness is vital. Providers should plan for all types of emergencies: fire, severe weather, even disease outbreak. The newly formed emergency preparedness team at Child Care Aware of America can help you with those plans. You can reach us at preparedness@usa.childcareaware.org. Our team members have a tremendous amount of expertise in this area, and I'm so pleased to have them at our organization. First, Julie Looper is our Senior Preparedness Advisor. Julie comes to Child Care Aware of America with a public health preparedness background and has previously led preparedness and medical reserve corps efforts at the national level with the National Association of County and City Health Officials and at the local level at the Oklahoma City County Health Department. Holly Nett is our Manager of Community Resiliency, and Holly has more than 20 years of experience in the child care resource and referral industry within the states of North Dakota and Minnesota, where she held leadership roles focused primarily on coaching and technical assistance systems for and delivery of early childhood programs. And finally, Andy Rozak is our Senior Director of Emergency Preparedness. As a former firefighter, paramedic turned attorney, Andy brings a unique perspective to emergency preparedness. His nearly 20 years preparedness career spans many disciplines, including work at the United States Senate, as a senior advisor to the U.S. Department of Health and Human Services, and as senior preparedness advisor for Super Bowl 46, and as senior director of environmental health Pandemic Preparedness and Catastrophic Response at the National Association of County and City Health Officials. Again, you can see with our team at Child Care Aware of America, and certainly coupled with the experts that will join us from CDC, we have a lot to share and expertise to provide, and I hope that you get something critical from this conversation today and continue to reach out to us as an organization and as an organizations that support emergency response, recovery, and preparedness. So with that, I'm going to turn this presentation over to Andy, and then we will hear from our colleagues at CDC. Andy?
Wonderful. Thank you very much. And it's great to have so many people on the line today to talk about this very important issue. Like Dr. Fraga said, we have a very exciting time here at Child Care Aware of America as we've launched our new emergency preparedness program. And we've been making great strides, but I wanted to bring a couple of things to your attention. First and foremost, we've launched a brand new website to make our resources easy to find, and you can go to childcareprepare.org to find all of these resources. The other exciting development we have is we now have a joint listserv with the National Association of Family Child Care, and that is a free listserv where child care providers can get together and talk about emergency preparedness issues, efforts, initiatives, and emerging trends. So it's free to sign up. We would encourage you to do so. You can find more info about the listserv at childcareprepare.org. We've also hosted a couple of recent blog posts that you might find of interest, one about Zika virus and what child care providers need to know. So a great list of resources and tools there on the blog post, many of which you'll hear about today from CDC. And we've also recently launched a new blog series with our partners at the National Environmental Health Association, focusing on children's environmental health issues. And our first post deals specifically with insect repellent and mosquito repellent, and which ones to use for children and which ones not to use. So I encourage you to check that out. You can go to childcareprepare.org and click on latest news to access all of these resources. All right, so today's premier topic is, of course, Zika and child care, and we're very lucky to have individuals from CDC with us today. So that's going to be the main focus of the webinar. Let me just get these slides to advance, and then we'll invite CDC on the phone. And I know we had a couple little blips with audio, so hang on one second. We want to make sure we've got our CDC partners on the line, and we can talk to them without any audio issues. So hang on one second as we switch over the audio feed, please. Okay, let's try out the audio. CDC, can you hear us?
Yeah, we can hear you.
All right, so it looks like the first presenter we're going to have is Jessica Franks from CDC. Jessica, can you hear us okay?
I can. Can you hear me?
You sound good from this end. We'll be monitoring the chat box. If you're having audio issues, please let us know, and we'll try to fix those for you guys.
Okay, sounds good. You ready?
All ready.
Okay, great. So I'm Jessica Franks, and I'm currently on assignment as a member of the Children's Health Team for the Zika response in the CDC's Emergency Operations Center in Atlanta. When I'm not deployed here, my regular role is a health communications specialist for the Children's Preparedness Unit within the CDC's National Center on Birth Defects and Developmental Disabilities. Today I'm going to discuss the basics of Zika virus disease and go over some protective measures specific to children. Next slide. Okay, first we'll discuss the virus and its transmission. And you can go to the next slide. Great. So what is Zika virus? Zika virus disease is caused by an infection with the Zika virus. It's a single-stranded RNA flavivirus, which is in the same family as dengue, yellow fever, Japanese encephalitis, and West Nile viruses. The disease is spread primarily through the bite of an Aedes species mosquito that must be infected with Zika virus. So if someone were to get bit by one not carrying Zika virus, he or she would not become infected. Next slide. Okay. Even though most people heard about Zika virus for the first time this year, it was actually first discovered in a monkey in the Zika forest of Uganda in 1947. Before 2007, at least 14 cases of Zika had been documented, although other cases were likely to have occurred and were not reported. Zika outbreaks have probably occurred in many locations. Because the symptoms of Zika are similar to those of many other diseases, many cases may have not been recognized. In May 2015, the Pan American Health Organization issued an alert regarding the first confirmed Zika virus infections in Brazil. And by December 2015, the U.S. territory of Puerto Rico reported its first confirmed locally transmitted Zika virus case. Next slide, please. Currently, outbreaks are occurring in many countries and territories. You can see on the map that local transmission continues in Puerto Rico and other U.S. territories such as American Samoa and U.S. Virgin Islands. The purple areas on the map indicate locally acquired cases or virus isolation. So we can see that right now there has been no local mosquito-borne transmission reported in the continental United States. However, with current outbreaks in the Americas, that is Mexico, the Caribbean, and Central and South America, travel-related cases among U.S. travelers have increased. Next slide, please. As I mentioned earlier, Zika is transmitted to humans primarily by Aedes species mosquitoes. And these mosquitoes are aggressive daytime biters, but they can also bite at night. Other modes of transmission are through the placenta, which is from a pregnant woman to her fetus, through sexual contact with an infected person, and via blood transfusions, which is likely but not yet confirmed. There can also be lab-associated exposure if a person were to get an accidental needle prick, for example. And there are two terms I want to make sure are clear for everyone. Local transmission means that mosquitoes in the area have been infected with Zika virus and can spread it to people. Whereas a travel-associated or imported case means that a person with Zika became infected during travel to an area with active Zika transmission. This includes a traveler becoming infected and anyone infected by that traveler, such as by sex. Next slide, please. Now, taking what we learned from the last slide, this slide shows that there are 755 travel-associated cases reported for the 50 states and D.C., and no cases from local mosquito transmission. For U.S. territories, including Puerto Rico, American Samoa, and U.S. Virgin Islands, there are 4 travel-associated cases and 1,436 locally acquired cases. This is over 2,000 cases total for the U.S. states and territories, and we know that roughly 10% of these cases are children under the age of 18. Next slide, please. Zika virus can be found in the blood of an infected person for about a week. If a mosquito bites the person, it then becomes infected and can pass the infection to others. So to help prevent others from getting sick, it's really important to avoid mosquito bites during that first week of infection. Anyone who lives in or travels to an area with Zika and has not already been infected with Zika virus can get it. But many people infected with Zika virus won't have symptoms or will only have mild symptoms. And once a person has been infected with Zika, they're likely to be protected from future infections. Next slide. The most common symptoms of Zika include fever, rash, joint pain, and conjunctivitis, which is redness or inflammation of the eyes. Other less common symptoms include muscle pain and headache. Current evidence suggests that only approximately 1 out of 5 infected people will develop symptoms of Zika virus, usually beginning 2 to 7 days after the bite of an infected mosquito. And again, symptoms are usually mild if they develop at all and can last up to a week. And it's extremely rare to die from Zika. Next slide. Diagnosis of Zika is based on a person's recent travel history, symptoms, and results of blood tests. Currently, a blood or urine test is the most common way to confirm a Zika infection, and a patient's doctor or healthcare provider may order multiple tests to look for several types of infections. There's no vaccine for Zika virus, and there's no specific medicine or treatment for individuals who become infected. Current recommendations are to treat the symptoms with plenty of rest, to drink fluids to prevent dehydration, and to take Tylenol to reduce fever and pain. It's important to not take aspirin or other non-steroidal anti-inflammatory drugs until dengue can be ruled out to reduce the risk of bleeding. Next slide. Now let's take a minute to discuss ways to prevent Zika virus infections. Next slide. Even though we don't have local Zika transmission in the continental U.S., mosquitoes can carry other diseases, and there are many things we can do to help protect from mosquitoes. The ones on this slide apply to both adults and children. It's important to use insect repellents registered by the Environmental Protection Agency. These should include one of the active ingredients in parentheses. Using EPA-registered repellents ensures that the product has been evaluated for effectiveness. And always remember to follow product label instructions. Also, wear long-sleeve shirts and long pants whenever possible. This is harder in the summer months, but it is helpful. And these can be lightweight and loose-fitting just so it's not as hot but still protective. Another step is to stay in places with air conditioning and window and door screens to keep mosquitoes outside. You can also take steps to control mosquitoes inside and outside your home, such as removing all standing water or tightly covering water storage containers outdoors so that mosquitoes cannot lay eggs, as well as keeping windows and doors shut and using air conditioning when possible. When indoors, mosquitoes rest in dark, humid places, like under the sink, in closets, under furniture, or in the laundry room. You can learn about indoor foggers and insect sprays to treat areas where mosquitoes rest inside the home on the CDC page listed at the bottom of the slide. Another step that sometimes is missed is to treat your clothing and gear with permethrin, which is a low-cost and highly effective insecticide registered by the EPA and sold in a number of products such as indoor foggers and sprays that I mentioned. However, it should not be sprayed directly onto the skin. Finally, sleep under a mosquito bed net if air-conditioned or screened rooms are not available, or if sleeping outdoors. Next slide. The steps in the previous slide apply to everyone, but there are additional precautions to take for young children. The most important ones include: do not use insect repellent on babies younger than 2 months of age. Instead, dress them in clothing that covers their arms and legs for protection. Do not use products containing oil of lemon, eucalyptus, or PMD on children under 3 years of age. Never spray insect repellent onto a child's hands, eyes, mouth, and any cut or irritated skin. Also, don't spray repellent on the skin under clothing. If you're also using sunscreen, apply sunscreen first and insect repellent second. And just as you cover a bed with a mosquito net, you can also protect infants and small children by covering cribs, strollers, and baby carriers with mosquito netting. Next slide. Obviously, you all as parents and child care providers are very experienced at talking to children about difficult or challenging issues. As you know, it's important to consider that children can better cope with any disease outbreak when they know about what is happening and that they can do something to help protect themselves and those around them. It's important that children understand the facts, and we can do this by tailoring the conversation to the child's age, developmental stage, and concerns. CDC put together a few key ideas that you can find at the link at the bottom of the slide. But these include to start the conversation by asking, what have you heard about Zika? Explain what you know about Zika simply and directly, such as explaining that people who are not living in or traveling to an area with Zika are not likely to get Zika. You want to gently correct false information and rumors they may hear from their peers. Give them correct information clearly using words they understand. And always help them if they're not coping well by encouraging them to express how they're feeling and to ask questions. Finally, children want to feel like they can help the situation. Explain what they can do to prevent the spread of Zika, like taking steps to prevent mosquito bites. Next slide. CDC has created a plethora of fact sheets and materials specific to Zika and children's safety. These are just a few I selected from CDC's site. You can find many more resources and most accurate and up-to-date information on the CDC's Zika site at cdc.gov/Zika. Next slide. Thank you all for your attention, and I'll now turn it over to Dr. Sonia Rasmussen for the next piece. Hey, Jessica. I'm Sonia Rasmussen. I'm a pediatrician and clinical geneticist, and I'm going to be talking to you about Zika virus and pregnancy. And as most of you probably heard, Zika virus, if it weren't for the effects that we know of on pregnancy, it wouldn't really be a big deal. It's really the effects of on pregnant women and on their fetuses that has made us concerned about Zika virus. Next slide, please. So I'm going to be giving you some information and recommendations for pregnant women, talking about the effects of Zika virus infection in pregnancy, that Zika virus has been shown to be a cause of birth defects, of microcephaly and other serious defects of the brain, and then give recommendations for people who live in or travel to areas with Zika. Then I'll be talking about some recommendations for couples that are considering getting pregnant, and then what moms need to know about breastfeeding, and then some information about the U.S. Zika pregnancy registry. Next slide, please. So, Zika virus infection in pregnant women. Pregnant women can be infected. The most common ways that they are infected are through a mosquito bite or also through sex with an infected male partner. So sexual transmission is something that wasn't really anticipated when we were first involved in this response, and that has been something that's been shown that men can pass Zika virus to their partners, either male or female partners, through sex, because Zika virus can be in the semen. And one of the tricky things is we don't know how long it stays in the semen. So that you'll see that in some of our recommendations later on. That is something that we're working on now to study, but we don't have those answers right now about how long it stays there. So if infected during pregnancy, the woman can get infected with Zika, and then she can pass that across to the fetus during pregnancy, either if she's infected during pregnancy or at the time of birth, and that's peripartum transmission. There's also concerns about if a woman's infected around the time of conception. We don't know yet whether women who are infected at the time, say you're getting pregnant at the time you get pregnant, there was Zika virus in the male partner's semen. We don't know if that causes a problem, but we're concerned about the possibility that has been seen in some other infections, and so we're concerned about that possibility. Next slide, please. So when this was initially Zika virus was shown to be causing problems in Brazil, and I'm sure most of you are aware of the many news reports were coming out of Brazil of lots of babies being born with microcephaly. And at first I think there was a lot of skepticism amongst many scientists that could Zika really be causing microcephaly, or could it be something else? After several months of collecting information, CDC reviewed that information, as well as the World Health Organization reviewed that information, and were able to confirm that Zika virus is a cause of microcephaly and other serious birth defects of the brain. And this was published in the paper in the New England Journal of Medicine in April. It was published online in April. Next slide, please. So what is microcephaly? Microcephaly just means small head, and of course some kids have a smaller head and it doesn't cause a lot of problems. What we learned about kids with microcephaly related to Zika is that it isn't just a small head, that there seems to be it's a small head due to damage that the virus has caused to the brain tissue. And here you can see in the upper picture, the drawing picture, these kids have severe microcephaly. It's not just a mild, little bit smaller than kids their age, and their gestational age, in fact, is quite a bit smaller than other kids that age. And also, there tend to be other signs of damage to the brain, such as the intracranial calcifications. You can see the very white, intense dots that are there compared to the bottom CTs that are normal ones. You can see on the top that there are some calcifications there, and those are signs of damage to the brain. On the right-hand side, you can see there's also very large ventricles. So that dark appearing color is ventricles, and usually those are really small, and you can see that they're really big there. That means that there's been volume loss in the brain of the baby, and it's filled with fluid because there isn't brain tissue there. So these kids, we don't know the full extent of the effects, but it appears that the kids that have been examined so far have had very severe effects on their development. Next slide, please. So we are concerned that Zika can cause other problems as well, and it appears that some women who have Zika virus infection during their pregnancy do have miscarriages and stillborn babies. But there isn't enough evidence yet to say Zika virus is the cause, although it appears that is likely to be the case because some of those babies have been found to have Zika virus in their placentas. Besides microcephaly, fetuses infected with Zika virus before birth have had many other problems other than just the microcephaly. Some babies have had seizures, developmental delay, intellectual disability, problems with movement and balance. Several of the babies that have been born so far have had feeding problems, including difficulty swallowing, and so they needed a G-tube. There's been babies that have had hearing loss, and then several babies that have had vision problems that we expect would mean that they would not be able to see. So there are a number of different things beyond just the small head or the microcephaly that we're seeing in these babies that have, their moms were infected during pregnancy with Zika virus. The next slide. So moving on to our safety recommendations. Next slide. So traveling to areas with Zika, pregnant women who should not travel to areas with Zika virus. And that is a strong recommendation from CDC. If there's a place that has transmission of Zika virus due to mosquitoes, a woman should not travel there. And the list of places that there is Zika virus transmission is available on the CDC website, and that's updated every time a new country is included in that list, and it's a large number of countries. So if a woman must travel, we suggest she talk with her healthcare provider before she goes, so that the healthcare provider can talk to her about what she is putting her fetus at risk for, and strictly follow steps to protect yourself from mosquito bites during the trip. Of course, it's hard to do that. It's hard to make sure that you don't get any mosquito bites at all. All it takes is one. Women should also take steps to prevent sexual transmission and to talk with her health care provider after she returns, even if she doesn't feel sick, because as we know, a good proportion of women who are infected, or a good proportion of anyone that's infected with Zika virus don't show any symptoms at all. So just because somebody comes back and didn't show symptoms doesn't mean that they didn't get infected with Zika virus. Their fetus still could be at risk. So this is for people who are living in and traveling to areas with Zika, and there is Zika virus in the United States, in Puerto Rico, and two other U.S. territories, but the biggest outbreak right now is in Puerto Rico. A recommendation for moms that are pregnant in Puerto Rico and other places where there's Zika virus are to prevent mosquito bites. And that's, you're using insect repellent. Jessica's already told you about that, and it's safe. It's safe even during pregnancy, and it works. Women should cover their skin with long sleeves and long pants, and including treating their clothing with permethrin. Of course, when you're in a really hot environment, it's hard to do that, but women should try to do that as much as they possibly can. Then mosquito-proofing homes is really important, and CDC's been working in Puerto Rico to help women to have pregnant women to have screens on their homes, so it's important to have screens and air conditioning when possible. And then those mosquitoes, they lay their eggs in standing water, in buckets, in even very small amounts of standing water, like a cap of a Coke bottle, a Diet Coke bottle, a soda bottle. Even something as small as that can have where mosquitoes can lay their eggs. And so it's important to eliminate any standing water around the home or in the community. It's also important to prevent sexual transmission, and that's important for people who are living in or traveling to. It's also important if a woman's living in the United States and her partner travels to one of these places. When he comes back, he could have Zika, and he should use a condom the right way every time they have sex, or not have sex for the remainder of the pregnancy. That is, I know that's a hard recommendation to follow, but that is the recommendation for women who are pregnant whose partners have traveled. Next slide. So CDC has put together some tools for pregnant women, and these are available on our website, and these make it very clear what the recommendations should be, so you can refer women to this information. Next slide. I also wanted to talk about women who are planning a pregnancy. Next slide. So for women and their partners who are thinking about getting pregnant or not doing anything to actively prevent getting pregnant, they should, if they're thinking about traveling to some place where there's active Zika virus transmission, they should talk to their doctor or healthcare provider. They should take steps to prevent mosquito bites and take steps to prevent getting Zika through sex. The women and their partners who are thinking about pregnancy should talk to their doctor or healthcare provider about their plans for having children. If women aren't thinking about getting pregnant now, if this isn't the time for them to get pregnant, the doctors should talk to them, the healthcare providers should talk to them about effective contraception, especially for women who are living in areas where there's active Zika virus transmission. If someone doesn't want to get pregnant right now, not a good time to get pregnant because of the risk of Zika and how difficult it is to completely avoid that risk if you live in an area like that. The healthcare provider should also talk to them about the potential risk of getting Zika during pregnancy and their partner's potential exposures to Zika. Next slide. So for women and their partners who are thinking about getting pregnant, and this is where I mentioned before that we don't know how long that Zika virus remains in the semen, and that's why there's longer times for the man than for the woman. Because for women, what we're worried about is if this is a mosquito that has Zika virus and the mosquito gets in her blood, we need to wait until the Zika virus gets out of her blood. But for a man, it has to get out of his semen, and we know that the semen viruses stay there longer than in the blood. So if there's a recent travel to an area with Zika or sex without a condom with an infected male, for women, the recommendation is to wait at least 8 weeks after exposure, or if they get or after symptom onset. So for men, it's a little more complicated. If they didn't get sick, if they didn't show any symptoms, the recommendation is to wait at least 8 weeks after exposure. However, if they have symptoms, if there's a concern that the man could have had Zika virus disease, they should wait 6 months to avoid the possibility of him passing that Zika virus to his partner and then her getting sick in very early pregnancy. For couples that are residing in an area with Zika, similarly, the Zika virus disease, for people who have had Zika virus disease, for the woman, the timing is to wait 6 weeks after symptom onset, and for men, 8 weeks after symptom onset, and for men, 6 months after symptom onset. For residents in an area with Zika, for someone who hasn't had any signs of Zika virus disease, for men and women, the recommendation is to talk with their healthcare provider. And this is so that the healthcare provider can ensure that the couple understands their risk in living in a place with Zika virus, and so they can discuss whether this is the time that they want to get pregnant because of the risks that they could be placed in their fetus. Next slide, please. So breastfeeding the Zika virus, next slide. Zika virus has been found in breast milk, and Zika virus RNA as well as live virus. So there is concern about the possibility of Zika virus being passed from a mom to a baby by breastfeeding. However, there haven't been any reports of that yet, and we expect, as you heard from Jessica, that the baby would be mildly affected if the baby got Zika virus. And we know that there's lots and lots of benefits to breastfeeding. So the current recommendation by the World Health Organization as well as by CDC is that mothers are encouraged to breastfeed even in areas where Zika virus is found. Next slide, please. I just want to briefly mention the U.S. Zika Pregnancy Registry. I've talked to you about that there's a lot of unknowns right now. There's a lot of things that we don't know. We don't know, for example, what the risk is to a baby. We know that babies can have microcephaly and severe brain defects if the mom was infected during pregnancy, but we don't know how often. We can't say it's one time in 10 or one time in 100 or one time in 30. We don't have that information right now. We also don't know the full spectrum of problems that are associated with Zika virus, and this is something that we've seen, for example, when we first understood about rubella virus. The first people thought it was mainly eye problems, and they learned it was eye and ear problems, then eye, ear, and heart, and many other problems. So we don't know the full spectrum right now of the effects of Zika virus. And so CDC has developed a U.S. Zika Pregnancy Registry to learn more about the effects of Zika virus infection during pregnancy, to answer some of those questions, and also to learn more. As I said, we don't know the full spectrum. Are there kids that look babies that look completely normal at birth that then may have learning problems later on, or problems with their development? And we don't know if that could happen, but that certainly is a possibility. CDC is going to collect health information about Zika among pregnant women and their babies across the U.S., working with the state and local health departments, and we're going to use that information to help pregnant women and families affected by Zika. And the knowledge gained from this registry will help doctors and other healthcare providers care for pregnant women and their babies. Next slide, please. So I just wanted to thank you for listening to us today. And if you have questions, my email address is there. There's also for clinical questions, there's the email address. And then if you have questions about the Zika Pregnancy Registry, there's an email for questions about that too. And we'd be happy to answer any questions you have at this time.
So it looks like we have a couple of questions. One was about the transmission of Zika. I know you talked about sexual activity, especially men's semen. There was a question in the chat box about kissing and saliva.
We don't have any evidence at this point that kissing and saliva passes Zika virus, but as I've told you, there's a lot we're still learning. We do know Zika virus is in saliva, but we don't have any evidence that you're able to pass from one person to another from saliva. But we will be continuing to update our information on our website as we learn more.
And it looks like the next question is, where has Zika transmission taken place throughout the world?
So it's been many places throughout the world. It started off in Africa, as you heard from Jessica, then moved to different places in Asia, to the Pacific Islands. And it wasn't in the Americas, in our part of the world at all until Brazil. It was first noted in early 2015 in Brazil, and now has spread relatively quickly since that time to, the last I looked, it was 47 other countries. And that was I think, I don't know if you just getting, if there's a, or just getting, on the CDC website, there's a list of all the travel places that are up, and it gives you a list of all those countries. Yeah, so since it changes so often, I didn't look today, and so it's probably not good for me to say exactly the number. But it does include Mexico, it includes 3 U.S. territories, so it includes American Samoa, U.S. Virgin Islands, and Puerto Rico. So I strongly recommend that women, before they consider traveling, look at the latest information, even right before they get on the plane.
So here's a question about the breastfeeding and the breast milk. Is there any evidence to suggest that children who have breast milk with the Zika RNA build up an immunity to Zika?
Well, if the baby gets Zika infection, they will build up immunity, and then they would be, from what we understand right now, they would be protected from future infections with Zika virus. Yes. So, but that's, I mean, the RNA is there. The RNA is evidence that the virus is there too. So, not sure if that answers the question.
Here's a question here. Is there an age at which the child is no longer at risk for Zika? And I'm assuming they mean a child in the womb, a child that's developing inside the mother is no longer at risk for Zika.
Yeah, that's one of the other questions that we don't have the answer to. So we know that the babies that have been born with microcephaly, in general, they've had infections in the first trimester or generally in the early second trimester. There was a study that came out last week from Colombia, and the study from Colombia looked at babies that had been infected in the third trimester of pregnancy. They didn't appear to have microcephaly, but the babies haven't been followed up long enough. They were just looking at the babies at birth, so they haven't been followed long enough to know if they might develop problems later on. So, you know, might they have problems with learning, hearing, eyes later on? We don't have the answer to that. It appears that the microcephaly risk appears to be earlier in pregnancy. So that's another question that the Zika virus pregnancy registry will be working to answer. And NIH also has a large study that they've just recently launched trying to answer some of those questions too.
And I've got a lot of questions in the chat box about the reports on the news over the last couple of days about a vaccine or a cure for Zika. Do you have any comment or thoughts on that potential vaccine?
Yeah, there is work towards a vaccine, but vaccines take a long time. They take, you know, the vaccine can be made, but then it has to be tested in a large number of people before the Food and Drug Administration, the FDA, can say that it's safe and it's ready to use in a broad group of people. And so I know that it's dangerous to talk for NIH, but I think that NIH is saying that they don't think there'll be a vaccine available for this mosquito season. I think it'll be at least a year away. So timing of vaccines are difficult to predict because it has to go through those studies, a randomized controlled trial, then it has to go to the FDA, and FDA needs to make approval. So I think people are very hopeful that a vaccine will one day be available, but right now what we have to focus on right now is these other methods of prevention, either not traveling there or if you're living in a place, protecting yourself as much as you can from mosquito bites.
And I had a couple people ask just to review the signs and symptoms of Zika, especially in children, and if they see some of these signs and symptoms, should they refer them to a doctor to get tested, or what would the recommendation be for that?
Yeah, so the signs and symptoms, it affects children the same way that it affects adults that we know right now. So it's fever, conjunctivitis or red eyes, joint pain, and rash. Yeah, and the rash is typically pretty horrid. I mean, it's a pretty clear-cut rash, and so people have that covered in a rash. Of course, lots of kids have lots of rashes, but if they have a rash, fever, conjunctivitis, pain in their joint, some kids also can have muscle aches or headaches. They should be seen by their doctor, and they can be considered if they've been in a place where they could have been exposed to Zika.
Yeah, this is Eric Chuan, another one of the pediatricians on the response, and something that we've been trying to make sure the parents and child care providers are hearing a lot is, even though we're saying Zika virus can't pass from one child to another through casual contact, it does look like a lot of those other illnesses that can be much more common or very serious in children. So absolutely, those symptoms, the child should be referred for medical care, and then the medical provider can determine if that particular child has the risk factors that would warrant a Zika test.
And it looks like we had just a couple more iterations of the breast milk. So just to reiterate, there has been some Zika RNA found in breast milk, but at the time we don't know of any cases that have been passed through breast milk. So the recommendation now is the benefits of breastfeeding outweigh the benefits of not breastfeeding. Am I saying that correctly?
Yeah, the benefits of breastfeeding outweigh the potential risks associated with Zika virus transmission through breast milk, because we don't have any proven Zika virus transmission through breast milk at this time. And also, we expect, as we discussed, the main concern about Zika virus is getting it during pregnancy. And of course, the little baby isn't at risk of getting pregnant.
Right. So to reiterate again, I'm just looking through a lot of the comments. There is really no way to pass Zika virus just person-to-person contact, except for the sexual contact, and largely through the semen. It seems not through kissing, not through hand-holding, not through sneezing, none of that. It's really the sexual activity that we're most concerned about, or the bite from an infected mosquito.
Right.
Are there any special precautions? A lot of the folks are saying that many children and families are traveling for the holidays and for vacation, and when they're coming back into their child care settings, are there any special precautions or any signs that child care providers should be looking for with children that they know have just returned from Latin America or somewhere that's had some Zika?
No, nothing particular with Zika. I would say use your instincts and use your skills like you would before Zika was around. There are obviously a lot of other concerning diseases that spread in America and then in the countries you just mentioned. So a child coming back from travel overseas with a fever, that's absolutely a concern that should be raised to a medical provider right away. And not just because of Zika. Something like malaria, the most common reason that children end up really seriously hurt or dying from malaria in the United States is because they come back from travel and nobody checks for malaria because we're surprised by that diagnosis. We're not used to seeing it here. So absolutely be vigilant about symptoms in a child returning from travel. But you would be doing that anyway, about Zika, and this is just one more potential disease that the medical provider would be watching for.
And I'll just give you just two more questions. One is about just general precautions. Again, I know you covered some of them, but just to reiterate, standing water, of course, is the big one. But other precautions that folks can take, repellent, long pants and long shirts and clothing.
Yeah, being as much as possible in air conditioning or places with screens on the windows. And as Jessica mentioned, if you have a baby, there's ways to cover the crib or to cover the stroller, trying to keep that baby protected from getting bitten by a mosquito as much as possible.
And we have a lot of curiosity about CDC, and I will say I know this is a huge response, and we really appreciate you guys taking the time to talk to us and our constituency here today. There's a lot of questions just about the CDC efforts to monitor the spread of the disease. Obviously, a lot of folks have seen the Olympics are coming up very soon, and we know there'll be a lot of travel down to Brazil and other areas. Are you able just to talk a little bit about how CDC is tracking the spread and making sure that we have a handle on what's going on here in the United States?
Yeah, CDC is working very closely with the state and local partners. So we are working, and actually we started this many months ago, helping states to be ready. States where, so we have a good idea, and this is also on the CDC website, of the states and the areas of states that were concerned about Zika virus transmission because the mosquitoes that transmit Zika virus, the Aedes aegypti, Aedes albopictus, are distributed in those areas. In those states where we were mostly concerned, what we did is we actually had a Zika virus summit here with many people from those states coming in and talking to them about the things that they needed to get prepared for. They needed to prepare for testing mosquitoes, testing people, for example, if there is local transmission at a higher level, we want to be sure that people can't be getting it through blood transfusion. And so much of what we have learned from our colleagues in Brazil and Colombia, and now from our colleagues in Puerto Rico, the states here are ready and to institute those things if there's mosquito-borne transmission in the United States, the continental United States. So we have been working very closely with those state and local partners.
And just a couple of clarifications. I think folks were just reaffirming, the mosquito is really the vector that's transferring this disease. So the mosquito would bite someone who already has Zika, and then it would fly off and bite someone else, and thus the spread of the Zika virus. The Zika virus doesn't really originate within the mosquito. It's more of a carrier that transfers the virus between humans.
Exactly.
So again, eliminating the mosquitoes and making sure there's no standing water around is very important. Also, there was a comment about why is air conditioning a deterrent for mosquitoes, and that's simply because you don't have your windows open. If you don't have air conditioning and you do have your windows open, make sure you have your screens intact, make sure the screens aren't torn, make sure you're not keeping the door open for a long period of time, which allows mosquitoes to enter in.
Right. You got it all right. And also insect repellent. That's real important too.
All right, so I'm looking, looks like we've cleared up most of the queue. There was a very interesting question about how many mosquito bites result in an infection, and I think it's almost the luck of the draw. It might be, you might have the mosquito that has the Zika, and it might take one bite, or you might get bit thousands of times and never get Zika. I think it's really just the luck of the draw on that.
Exactly, and how many of the mosquitoes in a certain area are infected. And right now there aren't any that we know of in the continental United States, but certainly there are in some of the territories, and we know that there is a significant risk of this spreading as quickly as it spread throughout the Americas. There is risk for this occurring in the continental United States and the 50 U.S. states during this mosquito season.
Wonderful. And I mentioned we did have a nice blog post up. It's called Fight the Bite. You can find that on childcareprepare.org under latest news. And it does give you a rundown of the repellents that both CDC and the Environmental Protection Agency have recommended for children of various ages. So I'd encourage you to check out that great resource. Well, I just want to extend a huge gratitude for our friends down at CDC. We know that you're very, very busy. We really do appreciate you taking time out this afternoon to talk to the child care providers throughout the country. We had almost 1,000 people that registered for this webinar, so we know there's a great need out there. And we also recognize there's many folks that are actively caring for children right now and were unable to join us, but they'll be definitely watching the recording of this, which will be posted on childcareprepare.org. As well as the slides. So just give us, about 48 hours, we'll get all that posted online and it'll be available there for everyone. So with that, I just want to say thank you very much for your participation. Certainly we know we'll hear more and more about this as the summer lingers on and the Olympics take hold down in Brazil. Please feel free to email our team here at preparedness@usa.childcareaware.org. At any time, we'll get you hooked up with the answers to your questions. And again, a huge debt of gratitude to our friends down at CDC. Thank you for all the work that you do. We really do appreciate it.
Thank you.
All right, with that, we'll end the webinar, and hope everyone has a great rest of the week and a very happy 4th of July. Thank you so much, everyone.